When the coronavirus, which has now penetrated to the community level, struck the country in March this year, the government, through the Ministry of Health, clarified that it was inevitable that some healthcare workers will get infected with the COVID-19, but infection was not a death sentence, emphasizing that one stood a good chance of recovering from the virus.
When you talk about government quarantine,
the government also reiterated its commitment to protecting all its frontline healthcare workers by providing them with the necessary equipment to protect themselves as they went about their duties. But this has not been the case if what healthcare workers unions officials are saying is anything to go by, and already
our lives as frontline soldiers is our constitutional right.
They have issued a 21-day strike notice effective November 15th as they urge the government to urgently outline a strategy that will see healthcare workers saved from the virus.
It is never the solution to have a labor industrial action in a healthcare setup. We want to pray that all those issues that have been brought forth by the leadership, my colleagues in the healthcare industry, we can sit on a table and iron them out amicably without disrupting the services to the wananchi.
By September this year, a total of 945 healthcare workers had been infected with the virus, whereas 16 of them succumbed to the virus across 35 counties in the country. This number has almost doubled as of November 16, 2020, with at least 2,000 healthcare workers having been infected with the virus and at least 22 succumbing to it. Of the 22, 15 are nurses, while 7 are doctors, according to the National Nurses Association of Kenya. The second wave of the virus posing as a threat to the healthcare system.
The entire workforce is in a very somber mood. It's a very emotive period and moment for us. As we are standing here and those who are seated, we are having over 2,000 health workers having been infected. We have about 15 nurses whom we've lost from COVID and 7 doctors.
The Kenyatta University Teaching, Referral and Research Hospital, which is in Nairobi County, has been at the forefront of the fight against COVID-19 in the country after it was gazetted as a primary treatment and isolation facility in March 2020.
So the trend is on an upward trajectory, and it seems COVID-19 cases are going high, and obviously that will mean that the need for PPEs is very, very critical.
The ultra-modern 650-bed capacity state-of-the-art facility has been playing its role in helping the government's fight against the pandemic by providing space and expertise to combat the spread of the disease, with more than 400 beds and a 24-bed ICU set aside for COVID-19 patients.
We have 72 patients who are COVID positive, who are already admitted. We also have others who are in critical care, and we also receive patients who are suspects who have not been tested yet and are waiting tests to be done within the facility. We have not lost a single staff from our facility, but we have lost a few healthcare workers who came for treatment here, who were healthcare workers in another facility. But as an institution, we have been very lucky in that we have not lost a single staff.
In an effort to assist healthcare workers at the facility in the fight against the virus, Equity Bank, in partnership with the COVID-19 Fund, on Monday donated to the hospital PPEs worth 3 million shillings, this being a fourth consignment to the facility, with the staff being optimistic of not coming in contact with the virus in line of duty. The Kenyatta University Teaching, Research and Referral Hospital is one of the top facilities in the country that is accommodating COVID-19 patients. The facility is already recording a surge in the number of COVID-19 patients due to the increasing number of COVID-19 cases in the country. Dickens Ulvanda, Hope TV News Watch in Nairobi County.